Hi everybody, this is Kim Sickler. I'm one of the advanced practice nurses for the Palliative Medicine Service. I just want to start off today's coffee break by saying what an amazing experience this has been to be a part of all of this, and I hope you've enjoyed it as much as I have. I really love reading all your posts and responses to the comments. It's been really exciting to see all the information everybody has to share. I also wanted to take a minute to apologize. I'm so sorry I was not available to do the talk about. I really tried to get on, but it kept kicking me off, so unfortunately I was having computer issues the entire time, so I apologize. But I was able to read through some of the responses and comments and make some comments myself, so hopefully that was helpful for you all. So today during our coffee break, I'd like to, start off by saying I really don't drink coffee, so I'm kind of a tea drinker. So I have my green tea. That's kind of what my go-to, kind of my daily go-to, actually. So hopefully you're enjoying your coffee or a latte or whatever, and I'll be enjoying my green tea. But one of the things I wanted to focus on today was fatigue. I think that I was kind of thinking about some of the comments and, the episode that you guys watched and everything. And, I think fatigue is just so common, and we see it so often in our patients. And, it's oftentimes they are describing, they don't even recognize what it is. It's just some like overwhelming feeling of exhaustion. Really having some kind of unclear etiology as to where all this exhaustion is coming from for them. And, usually it's often multifactorial, whether it's from their chemotherapy or from their radiation therapy or disease progression or family issues or emotional issues, anxiety, pain. I mean, there's so many things that often play into fatigue for patients. And really, one of I would say it's probably one of the most common complaints I hear from people, and really kind of trying to hone in to what the cause is for this patient and how we can help them with symptoms of fatigue. Oftentimes there's an easy fix like medications for fatigue, like, is it just, the overwhelming feeling of exhaustion from the chemotherapy, and maybe we can help temporarily with some steroids or with methylphenidate or something like that. But, a lot of times patients feel overwhelmed with pill burden, and to them, taking another medication is just almost too much to manage. So I really like to kind of get to the bottom of things and find out what is not only the cause of fatigue, but, how they envision wanting to kind of cope with it, or what's reasonable for them. And that kind of goes back to kind of figuring out some goals for them and what's most important. Is it most important that I'm able to sit and have dinner with my family at nighttime? I don't care about if I'm sleeping all day or whatever, but that dinner meal is so important to me. So kind of really finding out what's most important and how we can combat the fatigue that way. Sometimes it's just simply even telling them to take rest breaks. Like they don't oftentimes understand that how important it is to incorporate rest breaks into the day. So by that I mean, oftentimes I will be telling my patient, so you wake up in the morning, you have breakfast, maybe you do a mild activity, and then take a rest. Sometimes that's a nap. Sometimes it's just sitting on the couch putting your feet up. And then, you get up, you have your lunch, and maybe do another activity, and then take another rest, and then you'll have your dinner and rest and go to bed. And sometimes, that's all that people can manage. So really encouraging them to schedule their day, schedule their rest breaks, schedule their activities so that they're not doing too many activities during one day. Asking for help. Also considering DME, some kind of equipment. Like, is it exhausting for the patient to walk from the bedroom to the bathroom because the bathroom's down the hall and around the corner? And would they rather conserve their energy to do other things than do that? So, maybe they'd benefit from a bedside commode, or helping them with taking a shower. Some people find showering just absolutely exhausting and actually have to lay down after they shower. So how can we alleviate that? Maybe it's getting a shower chair for them, or getting a home health in to evaluate their equipment needs and what they can benefit from. The other thing to be thinking about is, are they sleeping at night? Oftentimes, people don't realize that they need their normal amount of sleep and then some. And, so finding out, are they sleeping at night? Some people will say, well, I can fall asleep okay, but I'm waking up in the middle of the night, and then I have these ruminating thoughts, and I can't stop the thoughts, and so I can't get myself back to sleep. So, that can be causing fatigue, not only the anxiety around the thoughts, but also, not being able to sleep because of it. And so how do we deal with those? And a lot of times for those kind of things, I like to turn to my social worker to kind of help with emotional support and anxiety. And, sometimes patients can benefit from things like mindfulness, or meditation, or, guided imagery, things like that. So really looking outside the box for alternatives other than strictly going to the medications. In fact, I had a patient yesterday who I was seeing, and she found the most important thing for her was spending time with her children. But she was so exhausted that it was just something that she could barely muster enough energy to do. So, my whole goal with her was, okay, well, how are we going to get you to have that time with your kids? So, and she was really not into taking any kind of medication for much of anything. So we actually did a lot of talking about Reiki therapy. For her, that was something that was actually working for her. And so we talked about Reiki therapy. We also talked about the fact that she wasn't really sleeping at night. So we talked about, alternatives. She wanted to try things that were natural. So we talked about cannabis as a possible option for her. And it turns out it was something that she actually had tried and was maybe open to trying again. So, kind of trying to think what's going to work best for each individual. And finding out what's most important to them, so trying to meet their needs. Because, I find that a lot of patients don't recognize that all the other things in life that have been going on for years, like, I have to clean the house, I have to pay the bills, I have to get the kids to school, those things don't stop. Those things still need to happen. And now they're throwing in managing a serious illness and, coming to multiple doctor's appointments, which is exhausting, and having treatments, which is also exhausting. So, reminding people that, they've added a lot of things to their plate. So, trying to encourage them to take things in stride and to really slow down and look at, how much they're trying to manage. And, if they had to pick one or two important things, maybe we could focus on that first and try to get those things done first. And then, and getting those things accomplished may give them kind of a sense of accomplishment that maybe I can try something else, or adding in something else. Another thing I actually was going to mention and I forgot was also mild exercise. Really incorporating some really gentle, mild exercise can actually be energizing for people. So, maybe today it's walking to the end of the driveway. and tomorrow or next week it's walking a couple houses down, and kind of really encouraging them to increase their endurance as much as possible, but not going overboard. So kind of tuning in and listening to your body as to when is enough. And after, you do your mild exercise, then it's time to lay on the couch and put your feet up. So thinking of things like that for them, I feel can be oftentimes really helpful, and don't make us necessarily come across as the pill pushers. We really want to encourage lifestyle modifications that are reasonable and can be helpful for patients too. So those are some of the things that I think might be helpful and to consider when you're talking about fatigue, really getting to what's most important and kind of thinking outside the box, what can be really helpful for people. I know Josh had mentioned fast facts as a option for symptom management, and I just wanted to say that I really support that. I use fast facts quite a bit, in fact, as well. It's constantly being updated, so it's a great resource to consider. And I think that's about it. So I really look forward to hearing your responses and your comments and questions. And I know upcoming, the next module that's coming up is spiritual care. So I hope you look forward to that. I'm excited to watch that as well. So please submit your questions, and I'll look forward to answering them. Okay, take care. Bye.